So I have my patient here today. We're going to be doing two different movements. The first one we're going to be doing is a muscle length test for the gastrocnemius, and then we're going to be moving into a hip extension MMT. So we're going to first start with the gastrocnemius MLT. So what I'm going to have the patient do is ask him to lie prone on the table. So go ahead and lie prone. Now with the MLT for the gastroc, we're testing the length that the muscle can be stretched. So with the gastroc, I'm first going to have the patient flex their knee. We're going to be using the right side here. Up like this here. Good. You kind of foot just like that. Landmarks for this one, the axis of rotation is going to be the lateral malleolus. The stationary arm is going to be the lateral midline of the fibula, running down to the fibular head, and the moving arm, or the distal arm, is going to be the midline of the fifth metatarsal. And I'm just going to passively move her foot into dorsiflexion here. Just make sure this is all in line. Just going to passively flex the foot. Good. Keep going. So we get 17 degrees of dorsiflexion there. So now we're going to come down to the table here, come a little bit closer. If you want to slide just a little bit my way. That's good.
Okay.
Now if her gastroc is tight, this range of motion measurement should be a little bit less. So now we're just going to line up the same parameters again. Fibular head, lateral malleolus, and then we're going to passively dorsiflex the foot. She's got 4 degrees of dorsiflexion, and the normal range for the gastroc MLT, you're normally going to see a decrease in 7 degrees going from this position to this position, and she showed that here. So the next one is going to be a manual muscle test for hip extension. So the patient can actually stay lying prone for this one. And what I'm going to do is I'm going to stabilize here at the pelvis, and I want you, Crystal, to bring your leg up into hip extension while keeping it extended. Good. So going through that normal range of motion is going to indicate she has a grade 3 for her muscle strength. And now what I'm going to do, I'm going to have you go up into hip extension again, apply my force through the posterior knee right here, and that's going to indicate if she can hold it, 5, moderate resistance, and breaks, 4, etc., etc. So, are you ready here?
Yep.
Okay. Hold, hold, hold. Good. And relax. So we would consider that a grade 5 MMT for hip extension. We're going to do it bilaterally here. And then the other side. So once again, stabilizing here at the pelvis, and then I want you to go ahead and use your extensor muscles to go up. Good. And come back down, so that's a 3. So you can raise this back up here, and we're going to test the strength. All right. Hold, hold, hold. Good. So she has a grade 5 on both sides, so she's good.